We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
So let's start with some Q&A. We should have some microphones. I'm going to look to Heather or Sue-Ann. We have one. If you could bring it forward. If you'll raise your hand, and the rule of order is to introduce yourself by name and country. Ask, please, a brief question. We have 10 minutes for this panel. And then we will start with panel 2, moderated by Dr. Raja Flores. Who has a question? Vince. Heather?
Thank you. Is this working? Yes. Vince Hagedorn. I'm from England. My wife and I met Linda some 5 years ago, and last year Carol died of, well, having had mesothelioma for 5 years and 10 months. Firstly, I bring greetings to you all from England, from two groups, the Asbestos in Schools group that is fighting to get asbestos removed from schools, and the second one, which Carol was very instrumental in, is the Joint Union Asbestos Committee. Now, all of the teacher unions in England have, and Scotland and Wales and the United Kingdom, have come together to fight the government against asbestos in schools. This includes not just the teacher unions now, but also the support workers and everybody else. And it's an amazing example of how unions can do good by working together. I'm just about to ask the question. The question is for Dr. Frank on behalf of Dr. Lehman, and it is to do with the ethical situation. We have in the UK a situation where government is advised by the Health and Safety Executive. The Health and Safety Executive is advised by a leading epidemiologist who basically tells lies. Now, the ethical problem here is that he tells the government nothing needs to be done, all right? The government, and he does all his research. When he asks his questions, as he asked Carol questions about teachers and so on, the form and the questions do not give any answers that could possibly be used in the research he's claiming to do. And at the end of it, the person who pays for all his research is the Health and Safety Executive, which is a kind of non-executive part of government. Now, corruption here is the corruption of ethics. And I just, yeah.
I need you, there's only 10 minutes. I ask
Sure.
you please to ask one question,
Yeah.
please.
So the question is, do you have the same situation in the United States that money corrupts ethics in scientists?
That's a tautology. Wherever money is found, it's going to corrupt some science, and we have many examples of that. The tobacco industry, the vinyl chloride industry, the lead industry, and certainly the asbestos industry. I wasn't aware of how bad things were in Great Britain. I will tell you that the asbestos industry in India went to their somewhat equivalent organization, the National Institute of Occupational Health, paid for a study. The study, of course, was done entirely inappropriately, had no chance in heck of finding anything positive, and yet they come out and say, see, there's no problem. There's an old axiom in public health: the absence of data doesn't mean the absence of disease. And those of us that have gotten a chance to look at that report and critique it have worked with the organizations over there, the Ban Asbestos Group in India, pointing out the absurdity of that. And just as a sort of, view of the world, when I got invited to the NIOH in Ahmedabad in India, I chose as my topic to present to them the same organization that had carried out this study, and spent an hour giving my talk on asbestos and sort of an opposite view. I think at the end of the day, the only thing that will overcome this kind of incestuous corruption that exists in scientific organizations is that people have to speak the truth. At the end of the day, the truth will win out.
Next question, raise your hand, please. Celeste, thank you.
Hi, Celeste Monforton from the U.S. Sandra, my question is for you. I'm wondering when your son was diagnosed, what did your family know about mesothelioma and asbestos?
Michael was diagnosed February the 14th, 2012, and we knew nothing about it, nothing. We know a lot now, but we didn't know anything about it then. But Michael was diagnosed February the 14th, 2012.